You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic of dental implants, board-certified oral surgeon, Dr. Hueler. Dr. Hueler, welcome to the program.
Thank you very much. It's a pleasure to be here.
Now, I know you brought some photos, so we'll get to those in a moment. But for people that don't know your center, ClearChoice, yes. Who's the typical patient and what are the different services you offer?
The typical patient goes across a large span of people. There are people who have had dentures who they don't fit in their mouth anymore, or they're so loose that they can't function. There are patients who have failing teeth, abscess teeth, lost teeth, and are just wanting to start with a new set of teeth and a new smile and a new life. And
is this true at your center, by the way, that people can walk in the day of the surgery or day of the procedure, they could have no teeth in their mouth, and they could walk out with a full arch of teeth that don't come in and out?
That is absolutely correct.
Is that routine or unusual?
We do that every day.
Really?
Every day. The patients usually, like I mentioned, have failing, what's left of their teeth are failing, or it's so costly that they don't want to restore them. And we're able to remove them, place 4 implants in each jaw, and then have the teeth attached that same day.
A full arch of teeth?
Full arch of teeth.
On the upper
Yes.
and lower.
Yes.
Now, you're an oral surgeon. What's your role in this process at ClearChoice?
We do the surgical part. So I do the sedation, the getting patients relaxed and comfortable. I remove the teeth, we place the implants, and then our prosthodontist designs with the patient and fixates those teeth to the implants so that they're stable and able to be chewed on.
At ClearChoice, so I get this straight, that typically how dental implants are done, you go to one center where they'll see the specialist, the oral surgeon, and then you go somewhere else to a dentist that puts the teeth on top, and maybe somewhere else with the imaging. You do it right there.
That is
like
correct.
This all under one roof.
That is correct, which is the beauty of this center. We have our prosthodontist there. We have the oral surgeon there. We're able to put people to, sedate them comfortably, keep them comfortable, and then we have a lab in the same space where they actually do the conversion, get the teeth made.
They make the teeth right there?
They create the prosthesis, the teeth, for the patient right there, and so that they're ready to go. Somebody comes in usually 6:45. They're oftentimes leaving by 2 o'clock with a fixed set of teeth.
With a full arch of teeth.
A new smile.
Where you are, in your city or county, are there a lot of people wearing dentures or headed to dentures?
As a practicing dentist, most people don't see these people in their offices, and so a lot of people are unaware of the number of people like this in the community. I would say there's tens of thousands of people who don't smile, can't find a photo of themselves smiling. They've never smiled to their grandchildren or their children. It's amazing. I had a patient about a month ago. Her daughter actually brought her in. I think she was 17 or 18, the daughter. Brought her mother in because she hadn't been out of the house. Has not kept her teeth in, so she can't leave the house. The teeth make her choke and gag, according to them. And has been to their dentist multiple times without success, and was looking for, is there anything we can do? And that's exactly what we do. And I think a lot of these folks think they're the only person out there like this.
Really?
They do.
Like when their teeth are falling out or whatever?
They have failing teeth. They don't show their teeth. They don't tell people about it, maybe their spouse or their loved one, but they are kind of living in a shadow. They're not proud of their teeth. They don't smile. And so I feel for these people. They're in a tough spot.
We say, or we said at the top of the show, no more dentures, that nobody should be wearing a loose-fitting denture. Elaborate on that.
Well, traditionally, if somebody was losing their teeth or on the way to losing their teeth, that was the alternative, is dentures. And fortunately now, it doesn't have to be that way. We can place 4 implants, get the teeth attached. They don't know that exists. And so they've seen the ads perhaps a number of times. It takes a lot of courage to pick up a phone and actually call. It really does. I commend these people for taking the first step to getting their life back.
You say that there's tens of thousands of people wearing an upper or lower denture or headed to dentures. If dental implants are so good that they could go in and get a set of teeth, the day of the surgery and walk out with, teeth that don't come in and out. Why aren't they all doing it? What's your take on it?
I think there's several reasons. One is these folks that are wearing dentures don't go to the dentist anymore. Unless there's a sore spot or something, they become unusable, then they are forced to see a dentist. But once their teeth were removed, they have believed that they're done with all that. Even though they're not living the way they could live if they had teeth that were attached. They just are done with it. Second group of patients, I think, have seen dentists over years of time, invested a lot of time and money, and it hasn't worked out the way they had hoped it would. There's either failing teeth, additional decay that needs more restorations, more work, or some of the teeth are so broken and fractured or diseased that they really can't be fixed. And there's a fear factor.
So the
because
last
of all
thing
those
they want to
previous
do
things.
is see you.
I'm not the person they want to see, they don't think, until they understand what we can do for them. And it's really true. I think, it might sound odd, but I actually have a fear of dentists myself.
Is that right?
I had a dentist as a kid who kept working when he shouldn't have kept working. And it takes me a week to psych up to get my teeth cleaned, honestly. So I empathize with these people. I absolutely understand that it's a fearful thing. And
so even to this day, you're still a little worried about it? It's just uncomfortable?
I am really not a very good patient. I have to use laughing gas, and I have to have a dentist that really handholds me. So seems odd, because that's what I do. But
so these patients that come in that are like you safely sedate them. Is that correct?
Yes, yes. They get sedated for the procedure, right? And it gets them through it comfortably. We make sure some of these folks need a medication the night before. Sometimes we give them a medication the morning of, and on top of that, we still need to sedate them to get them through it because of the fear and the anxiety about this whole thing.
So when it's all done, because I guess they don't have much of a memory of it, right?
They don't, no.
When they see the mirror for the first time, you say that they get pretty excited.
We try to call our patients the night of surgery whenever we can get a hold of them. And I had a gentleman probably 2 weeks ago, I called, and the person picking up the phone said, "Do you want to talk to the guy that's standing in front of the mirror?" And I said, if he's the patient, yeah, that's who I'd like to talk to. And the patient comes on the phone and says, "Doc, since I got home, I keep staring in the mirror. I'm sitting in front of the mirror. I have not smiled in 10 years, and I can't stop smiling in front of the mirror." And I was like, "Is everything else okay? Are you comfortable?" And he was just thrilled, absolutely thrilled. Changed his life.
If everything goes right, they go in, they get their teeth. You say they leave the same day with their teeth. How soon can they eat?
We want them to eat. Immediately after the surgery, they heal better, they feel better if they get food in their system. But they're on a softer diet for a period of time until everything's healed, and then they're good to go. They can chew whatever they would like. We have people actually calling concerned about, can I eat a steak? Can I bite an apple? And absolutely.
With their front teeth?
Their front teeth.
They can bite like a carrot, a raw carrot?
Absolutely, yes.
Like popcorn?
Correct.
What about chewy foods, like pizza?
Perfect.
So there's no restrictions?
Highly recommend it.
Do they look real? I mean, I feel like I could spot a denture walking down the street.
Our prosthodontist is an expert at helping people design a smile that makes them look natural and makes their teeth look natural. Shape, the size, the color, they just do a phenomenal job.
So what's more important to these patients? Do they want a good-looking smile, or do they want to just be able to eat and chew or get out of pain?
I think oftentimes they come in with one of those requests or those desires, and they leave not even knowing that the other one was so important to them. They come in with pain or abscessed teeth, and you give them a new smile, and they can't believe that that's a benefit as well. So there are some patients that come in that are just concerned about their smile. They haven't been able to smile, or they're unhappy with it. And when that gets changed to their liking, and what they oftentimes find out, though, is that they hadn't even realized this, but they weren't chewing or eating the things that they enjoy eating because their teeth weren't allowing them to do that. Whereas their new teeth allow them to not only smile, but chew in the way that they love to chew.
So your model, where you have both specialists under one roof working there together, is it more expensive to go to a specialist?
It shouldn't have to be, no, because we have everybody under one roof, and we do the procedure all in the same place. And so there's no time, there's no lost effort. Everybody's right there. We bring in team after team to get this done in the most efficient way possible. So,
is this the future of dentistry, by the way, where there won't be I don't know if it's going to be 50 years, right? But where the traditional dentures, the way we know them today, won't exist. The teeth will be attached to something.
I don't know why somebody would want dentures if they have an alternative. And I think dental implants are making that possible so that people don't have to have dentures. They just don't have to.
How old can you be to get this done?
There's no age limit. Our oldest patient is 104
Really?
years old, who had dental implants.
Why would a 104-year-old want to do this?
They wanted to chew. They were unhappy with the way their teeth were functioning, and they felt as though if I have 10 years left, which I'm not sure, probably not likely, but they wanted to chew the time that they had. They wanted to be able to eat the things they enjoyed eating.
So 80's young then?
80's
In
just
your
getting
chair.
started. 80's just
Is
getting
that
started.
right? So statistically, dental implants are more likely to fall out if you're 80 years old? Or?
Not at all. No, not
Really?
at all. No,
Okay.
no. Once your body heals with these implants, they should be good for life.
At your center, you say that you're transforming people's lives in one day. Elaborate on that.
We are. The reason I went into oral surgery and dentistry is when I was in college, I spent a month at the Mayo Clinic doing a J term or interim. And we saw a girl at the beginning of that month who had jaw deformities that were pretty significant. Hardly spoke, attractive girl, but very shy. Did the surgery the first week we were there, saw her for follow-up at the end of that month, and it was like she was a different person. And I thought, that is what I would love to do. I would love to do something like that where you can change somebody's life. In private practice as an oral surgeon, we do everything we can to help people, with pain or with issues, impacted wisdom teeth, all sorts of things, exciting things. But you don't get the feedback from patients like you do with this type of procedure, where they come back and they start crying, telling you how you changed their life. I don't get that when I take out somebody's wisdom teeth. Nobody tells me I've changed their life. With this procedure, people literally are transformed. They didn't even realize how limited they were until they have new teeth, and it changes them in a whole host of ways that maybe only they understand, but it's pretty profound.
So I'm sure it must be life-changing then for someone that literally can't eat or is very self-conscious about it.
Profoundly. I had a patient, it's been about a year ago now, she had an upper denture. Her husband did not know she had an upper denture. He did not know. And her concern was that, can I transition from this and make these teeth look like my upper denture so that I don't have to tell people that I ever had that as part of my life? There's a lot of people like that out there who are, they have kind of a secret. They don't smile. Some people run businesses. We've had salespeople come in who feel like it's limiting their career because they can't smile confidently, or they can't eat out confidently. And with sales, I'm told there's a lot of dining out sometimes with clients and things. And
yeah,
so
and there's a lot of smiling in sales.
A lot of smiling, right.
So a lot of people, they confide in you that they just never smile.
They can't even find a photo of them smiling. This is not we hear this a lot. It's surprising. And like I said, a lot of dentists don't see these people in their practices. They've oftentimes not seen a dentist for 7 or 8 years.
Because they're out of the system.
They're out of the system. They just can't deal with whatever it is anymore. Either the pain or the financial or all the components that make people afraid of the dentist.
Now, we should mention Medicare, Medicaid does not cover dental implants here in the U.S.
Right. We go out of our way to find ways that people can get this paid for. We have a number of plans that people can get involved with. Financing, ways to make this affordable for people. So there's not a lump sum necessary. It can be a monthly sum so that people can get this taken care of. I don't know how you put a value on it, honestly. When
you say there's a tipping point. That means their teeth are either about to all come out or they're already wearing a denture, but there's a tipping point where they finally come in.
Yes. And I oftentimes ask people when I see them in the consultation, what was it that made you finally pick up the phone? What was it that made you finally come in? And there's usually some occurrence, something happened. Another tooth broke, or somebody commented on their breath, or something. I had a guy, it's probably been a couple months ago now, who he is a janitor at an elementary school. And he took out of his pocket, when I asked him what finally made you decide, he took out of his pocket 2 letters and he laid them on the counter, and I didn't want to sit and read them necessarily right in front of him, but I said, what are these? And he said, these were letters from kids. There were 2 or 3 boys that were laughing at him because he had, I think, 4 teeth in his upper jaw, 2 on the bottom. They were laughing at him, and a teacher saw this and made them write apology letters to this guy. And he was like,
Wow.
Doc, I got to do something.
That's terrible.
I've got to. This is what some of these folks live with. It is.
Kids are brutal on that, making fun of him. So he comes in.
Fortunately, a teacher helped teach them, that that's not okay. But
So people like this could go in, and I'm sure there's a few appointments beforehand, getting imaging and things like that.
Right.
But in one afternoon, a guy like that could get a full arch of teeth, upper and lower.
Correct.
And that's it.
Usually come in
But that's
quarterly.
routine. You say you do this every day.
We do this every day, every single day. Not on weekends, but we do it every day of the week. Right.
Okay, we're going to take a quick break. When we come back, you brought some photos and more
Yes.
about the process, what they can expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
There's a way to improve your overall health by addressing your dental health, the ClearChoice way.
My cardiologist said, I don't want you to come back and see me again until you start getting something done about those teeth. That is the foundation of good heart health.
We're doing amazing transformations, and it's not just a smile, which is huge. Changes the person's total outlook. Function is better. Chewing, if you can chew your food, you're going to be able to chew better foods.
Most patients don't realize that their dental challenges can lead to serious health challenges. At ClearChoice, we understand that your dental health impacts your total health.
Feeling good and knowing that you're doing the best for yourself and for your own personal health, that is what's important.
Not just another dental procedure. This is a true life changer, the ClearChoice way. Call today to schedule your free consultation.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have board-certified oral surgeon, Dr. Hueler. He says nobody should be wearing a loose-fitting denture. Dr. Hueler, welcome back.
Thank you.
So, but what if, and I have lots of questions about, denture wearers and what you could do for them,
Yes.
but what if somebody comes in and they have bad gums and gum disease and they're bleeding gums and will the implants work with these people?
That's who we see. I mean, honestly, we see these people every day. Their teeth that are there are infected. They have abscesses. The gum tissue is infected. When we remove the diseased tissue, things become healthy. Everything gets, all the diseased gum tissue, the diseased teeth, all of those things get removed, and once everything heals, you're back to a healthy state.
So gums aren't the problem.
Gums are not the problem.
So it's in
No.
the infection so that you get the gums healthy. But
Correct.
are you able to, with these people that are really bad off, right?
Yes.
Can you do extractions in the same day as well and give them their teeth and they walk out with teeth that don't come in and out?
This is the most common story. We see this all
Is
the
that
time.
right?
It is. We see this all the time.
I've talked to guys and say, Randy, no, you can't do that. You got to extract the teeth and wait a little while.
No, it's not correct. We do this every day, and with great success. Absolutely great success.
Isn't it true? If somebody's been wearing a denture 30 years, they don't have enough bone to do this.
No, not necessarily true. We are able to, with the new technology, with the new scanning that we use, where we can see exactly where bone is, we can place implants and get these people taken care of. So it's. I think the general dental population maybe isn't as aware as they will be about exactly how this can be done.
So you do the surgery on a computer first. What does that mean?
We get imaging of these folks, CT scan, and it has a 3D model, and we can see exactly where the implants need to go, where they can go. We can plan this pretty in a significant way, very carefully, before we ever touch the patient. We know what the issues might be, where they need to go, what we need to change, anything like that.
Now you brought some photos.
What
are we looking at?
Yes. These are several patients that were treated in a ClearChoice center, and they had a number of different problems. This young lady had failing, she had a lot of dental work done in the past, but she had decay under almost all of her bridge work. All of the bridge work either needed to be replaced or restored, and she was just not wanting to do that because of cost and because of the extent of the decay. And so we were able to do exactly what we've been talking about. We removed what was left of the teeth and placed dental implants and gave her a full set of teeth that she functioned with that same day.
It's a pretty smile.
If you notice, and we see this a lot, if you look at their eyes or their expressions, or oftentimes if it's a woman, their hairstyle, things change when they have a smile that they love to show people. It changes so many things other than just their teeth and their ability to chew.
You think the smile's pretty important, right?
I think
because you're an oral surgeon.
Well, I think it's critical. And we have patients who say that they don't care about their smile. It's just they need function, or they need to be done with the discomfort or the pain that they're having. But when you give them a smile, you can tell it's a huge deal. It makes a significant difference for these people. You've mentioned that I'm an oral surgeon and that teeth are important, that I would think teeth are important. But I think you have to agree, everybody thinks teeth are important. Your smile is one of the first things people see. You have a beautiful smile. People notice that. They think positively about you oftentimes just because of the way you smile or just because of the way you present yourself. And so it's more powerful, I think, than maybe a lot of people want to acknowledge. It's a very powerful thing. When they do surveys of people of what's attractive, a smile is always in the top 3. It's always right in the top couple of things that people check, because it's the first thing people oftentimes notice about you is, are you smiling or are you not? So,
yeah, I guess charisma, is defined. And we've talked actually in the green room that even on a job interview, who do you hire? I mean,
exactly.
Twin sisters, one smiles, one doesn't.
Exactly. Somebody comes across not happy and the other person looks joyous. You want to work with somebody that looks joyous and likes to smile. Absolutely. It's very true. So here's another patient. So this woman is like so many people we see. She's got missing teeth, and the teeth she has are failing, and was heading to dentures.
When you say failing, meaning they're about to come out?
Well, in her case, she had some periodontal or gum disease, but a lot of it was decay. She had decay in a number of her teeth. And so they may have been able to be restored, but it's questionable. It's really questionable. And she just wanted a fresh start. One afternoon, she comes in and leaves with a brand new set of teeth, brand new smile. And this is her smile. And I think you have to admit, she looks profoundly different and profoundly happier.
They do look like real teeth.
Oh, absolutely.
So is there a design process that that the prosthodontists, I guess you work as a team, that where they decide what, I mean, does anybody even have a say-so on what their teeth are going to look like?
Absolutely. They discuss this with the patients in terms of color, size, shape, all of these things. So the patient is involved in that very
because
closely.
That's a young woman. That's very young to be wearing a denture.
Correct. This allows her to have teeth that don't come in and out of her mouth. So here's another patient. These are not my personal patients, but these are patients that.
So what you showed me today are.
They're ClearChoice patients. They're not. They weren't treated in our center, but because of consent and things, they wanted their pictures shown. They wanted their story told.
Okay.
And this is another gentleman who had significant problems with his teeth. Just about everything that we've talked about: decay, broken teeth, missing teeth, teeth that need root canals or have had root canals and have fractured since they had root canals. People like this, Randy, did not want dentures. They do not want dentures. They want teeth. They want teeth that don't come in and out of their mouth, that they can feel comfortable chewing with, that they can, and so they come in to ask if they can be a candidate for this. And here is his after picture. And again, if you look at his eyes, if you look at his smile, if you look at what our prosthodontist has done, they've filled out his mouth so his smile is wider. And again, I don't do this part of it, but his teeth are shaped and a little longer. They were so fractured off that he didn't even show teeth when he smiled sometimes. And yet his bite is correct. Everything is completely correct.
And he can eat whatever he wants.
He eats whatever he wants without a denture.
So you could buy like corn on the cob? Or
Absolutely.
Is that pushing it?
Absolutely. I highly recommend it. I tell people this. I highly recommend it. They'll say, "Can I eat this?" I go, "I highly recommend it."
Broccoli? Raw broccoli?
I tell them that they can't chew rocks. No rocks. But otherwise,
rocks.
Exactly. So this is another gentleman who came in. Now he is smiling. He's showing his teeth. But I think you would agree with me that if you look at this smile afterwards, he's
looks like a different guy.
He's happier. Right. He's much happier.
Now, is this true that on a lot of these before pictures, they don't even want to smile, or they smile with their mouth closed, and you have to talk them into it?
We have some pictures where we use retractors so that we can see their teeth because they just don't want to smile. Other ones, they'll smile, but they are not used to smiling. I don't know if the muscles are even working anymore for them to smile. And once they get their new teeth, it's really remarkable. So there's something else you haven't even mentioned, and that is the people that have dentures, the whole roof of their mouth is covered with acrylic. And so their ability to taste things, their ability to feel like it's their own mouth is very different than when you don't have that. These teeth have no roof of the mouth. They have no floor of the mouth. It's
So they can touch
just
the roof of their
teeth.
mouth.
Absolutely. This is just their teeth and gum tissue. It's not the roof of their mouth covered. So it's the closest thing we have to giving them their natural teeth back.
Now, we are just about out of time, and I know that there was something you wanted to bring up because you say a lot of centers, they do a lot of snap-in, snap-out dentures, right? You at ClearChoice like fixed. Teeth that don't come in and out. No snap-in, snap-out.
Correct.
Is that right? Why?
I don't think the patients really want that. It's always a compromise. They still have a denture. When they chew, that denture sits on tissue. It squeezes their tissue. They get food under their denture. They still have to take it out. They still have a denture. It's just more stable. So for somebody that has a completely unstable denture, it's definitely better than that, but it's not even in the ballpark to having fixed teeth. It's not the same at all.
If there was a tryout, I know this isn't possible, but let's say the denture where it comes in, they just try a fixed set of teeth over the weekend, you know?
They would, the thing that they would say is, why didn't I do this sooner? They would absolutely say that.
You hear that a lot, like I should have done this years ago?
Yeah. When I ask people, so what can you tell me about your experience? What did you like? Is there anything we could do differently? They say, I wish I would have been made to do this sooner. I wish I would have chosen to do this sooner. It's one of the most common things I hear.
We're out of time. I want to thank you for coming on the show. Final message, though. A patient watching this, they've been told their teeth have to go, or they haven't been to the dentist in 20 years. You see a lot of your patients are like that.
Yep.
Or the denture wear.
Yes.
What do you say to them? And they're skeptical, maybe.
I can say that we understand. We see people in your situation every day that have been fearful of seeing a dentist or have given up on dentistry, and we probably have a very good solution for you. We do have a very good solution for you. We can help you. I hope
it's a free consultation?
Free consultation, and I hope people take us up on it because we truly are looking to help these folks. And
at least, I guess, know your options. Know where you
absolutely,
stand.
and it doesn't mean they need to move forward, but they can absolutely find out what we can do, and if this doesn't make sense for them, and I'd be surprised if it doesn't.
All right, I want to thank you for coming on the show. Very good.
Thank you very much.
Pleasure to have
really
you
appreciate
come on
it. Nice
the
to meet
program.
you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.